Hi, my name's John Scott and I am chair of the Scottish Mental Health Law Review. This is a short video to cover some of the introductory matters in a report which we have recently published. The report's intended to say what work we've been doing since our last report in December, and also the work that we still have to do in this important job. We are due to put in our final report and final recommendations to the Minister in September of next year, that's September 2022. So we've worked back from that, as you would expect, and we've put in different stages for further discussion and consultation, much more targeted, focused consultation than the one that we carried out last year. So that was in 2020, when many of you took the opportunity to share your experience and your thoughts on the law as it is and the law as you think it should be. So we've still got a lot of work to do, and over the summer we're having more frequent meetings of the executive team. So that's myself and my colleagues who are leading the review. And we've paused some work that's been done through different advisory groups, and their work has been really, really important to us. Members of the executive team have led these different advisory groups, which have been composed always of at least 50% of people with lived experience. The advisory groups are the ones that we've been working mostly through were on children and young people, communication and engagement, compulsion, capacity and support for decision making, and also economic, social and cultural rights. And we've started a group recently on adults with incapacity. We, in our report, have included a summary of some of our thoughts on the purposes and the principles of mental health law as it is and as we think it should be, informed by human rights and international developments in human rights. So the work that we are doing just now is also happening in other countries across the world as they try to work out how best to make sure that people's human rights are respected. We have also set up 2 reference groups, and these reference groups, one is lived experience and the other one is practitioners, and they're helping us as we develop our ideas. We take them to these groups and discuss them there and get additional feedback. But as the then Minister for Mental Health, Claire Hawkey, said when the review was set up, lived experience has to be at the heart of our work. And that's also consistent with one of the relevant human rights principles involved, making sure that disabled persons organisations and the voices of lived experience are not just heard, but are heard and properly listened to. So in terms of lived experience, we've added to our executive team. Alison Rankin joined the team this year. Alison, many of you will know as the chair of the Royal Edinburgh Hospital's Patients' Council. So on the executive team, there's now 3 people with lived experience. And Karen Martin and Graham Morgan continue to share the role of vice chair of the executive team, as well as helping, as everyone does, on the advisory group. So that's been really important to make sure that the voice of lived experience is right at the heart of the review. Human rights is central to what we're doing, and we have been in contact with someone at the United Nations who's called the Special Rapporteur on the Rights of Persons with Disabilities. His name is Gerard Quinn. And we've met with him, and we'll be meeting with him again, just so that we understand what current thinking is internationally, and in particular at the United Nations, which has been a source of some of the ideas which are leading to a change in the law. There's been a lot of talk about social models, medical models of disability, and there's pros and cons for each of those. Probably none of them operates as a pure model of just either medical or social considerations. But we prefer, as we're looking to do something different, to think about a human rights model of disability, which can incorporate the best bits of other models, and ideally it will reflect best good practice at the moment, but it will also direct practice as we move forward. There's been other work that's been done that's influenced us, and one of the things in relation to human rights is that the National Task Force for Human Rights produced a leadership report, and the question they were looking at was about some of these international treaties that the UK government has signed up to, and what does it mean? You know, how do we make sure that it actually helps individuals to realise those rights? And one of the ways this can be done is by bringing these human rights directly into Scottish law. It's happened with the European Convention on Human Rights. It's going to happen with the United Nations Convention on the Rights of the Child. And now this National Task Force has said it should happen in relation to 4 treaties, 2 of which are relevant for our purposes. One is the United Nations Convention on the Rights of Persons with Disabilities, and the other is the International Covenant on Economic, Social and Cultural Rights. And that was important because it includes the right to the enjoyment of the highest attainable standard of physical and mental health. So because of their recommendations, it's not whether we put these international human rights treaties into Scottish law, it's how we do it and what that will mean. So that's part of what we are working on now, to translate beautiful words into the lives of people watching this video and others. So we continue with our work. We've now got just a little over a year left to go. We will be continuing to speak with individuals, groups, networks. At the moment, we're still doing almost all of our work online. That's limited what we've been able to do, but we've achieved a lot nonetheless. And once again, I want to pay tribute to those who've helped us. So it's not just my colleagues on the executive team and on the advisory groups and on the reference groups and in our wonderful secretariat. It's people who have been so generous in sharing their sometimes truly awful experiences, and not simply because they don't want it to happen to them again, but because they don't want it to happen to anyone else. So as people have been generous in sharing that, we accept the responsibility of trying to make recommendations roughly this time next year, a little after that, which will do what they're hoping will be done. Thanks very much for listening to me just now, and I'll hopefully see some of you, if not in person, then online at some point soon. Bye just now.